Come in.
Good morning.
Good
How are you
morning.
doing?
Good. How are you?
Good. My name is Nancy Eaton, and I work for Dr. Jones. I'm one of his nurses.
All right.
And he has given me orders that your little one needs hepatitis B vaccine today. Okay. Can you give me her name and date of birth?
Jane Doe, November 17th, 2016.
All right. Super. How you doing? You're a big 2-month-old. Yeah, they don't, at this age, the good thing, Mom, is they don't realize what's happening. They don't like it, but they don't remember it.
Okay.
Okay? Do you have any little ones at home?
I have one.
Oh, he or she?
She.
Is she getting excited about the baby?
Yeah.
About her little one? About her sister?
Yeah.
All right. Okay. It's okay. It's all right. It's good. Mama's got you. All right. So do you know anything about the hepatitis B?
No, not really.
Okay. Well, this is a vaccination information sheet that is put out by the Centers for Disease Control.
Okay.
It tells you a little bit what hepatitis B is. It is an infection. It can become a serious infection that it can affect the liver and, chronically, long-term it can turn into cirrhosis or even cancer of the liver.
Okay.
And so that's what we're trying to prevent completely. Okay? We give 3 injections, a series of 3. Did she get a dose at birth?
Yes.
Okay. So that was her first one. This will be her second one.
Okay.
Her third one can be given between 6 and 18 months.
Okay.
We like to give them around 6, but sometimes with,
Things
schedules and
happening.
things happening, it's a little later, but we definitely want to make sure that she gets that third dose as well to make sure she builds up those immunities. It also talks a little bit about some of the side effects and reactions. Do you have any questions about it?
So is she going to have a fever or pain?
Okay. She may have some local tenderness and redness at the site, and I am going to give it in her leg.
Okay.
I'll show you right here where I'm going to give it, right about here in the vastus lateralis.
Okay.
Okay? I know that word doesn't mean anything to you, but that's important, for us to know. So redness and a little tenderness. She may have a low-grade fever, 99 to 100. Anything over 101, we would want you to call it.
Okay.
Okay?
So should I give her Tylenol?
Routinely, no. Okay? Dr. Jones does recommend some Tylenol based on her age and her weight if it's over 101.
Okay.
But if you have any concerns, maybe she's unconsolable, any trouble breathing, you need unconsolable, call us, okay? Any trouble breathing, hives, anything like that, call 911 and bring her in.
Okay.
So we can check her out really good. Okay? Any other questions?
I don't think so.
Okay. I'm going to need you to sign this, okay? This is just a consent that we have gone over this review sheet, and I've given you a copy of it.
Okay.
Any other questions?
Is she going to be contagious, or do I need to worry about anything with my other child?
No,
Okay.
not at all. And of course, I'm sure she already has her series, so
Yeah.
she didn't have to worry about that anymore.
All right.
Okay. Well, let me get the medication set up, and then I'll take her from you, and we'll give her that injection.
Okay.
So class, you're going to have this little container of various immunizations that you need to choose from, choose the correct vaccination. Then you will also have a bin with syringes and different size needles that you will also need to choose the correct size. I'm not going to tell you which one those are because that's part of the review process and learning process of the scenario. Of course, I'm going to wash my hands again if I have not, okay? I'm going to come over here and gather my supplies. And I do have hepatitis B. I want to make sure I have the correct vaccine, and I'm going to check the expiration date to make sure it has not expired. Now, what you will find in many of the clinics, that medications that we pull from a vial are drawn up with a red blunt needle. We don't have these in here, so you can either change out that needle, which would be probably most appropriate. Okay, so I have my needle, I have my syringe. I'm going to pop off the little cap off my vial, clean it up really good. You will also need to know how much you are going to give according to the order and according to the correct dosage for the immunization that you're going to be giving. All medications need to be drawn up outside of the room, away from the child. A couple reasons. One, if the child is older, this may upset them, and they're going to know exactly what you're doing and be very upset. So you don't want to do that. And then also, if you're shaky and nervous, you're not going to want to do this in front of the mother, okay, or the parent, or the guardian. Let me grab a pair of gloves. Okay, when we're giving an injection to an infant under 1 year of age, or until they're at least walking for a year, we're going to give the immunization in the vastus lateralis, okay, and you do need to know that. Mom, I'm just going to show my class how we're going to give these injections. Typically, I do take the child from the mom and lay them on the exam table with their legs hanging off, with my body against them, so that I can control their lower extremities. But this is the area that I'm going to be giving the injection, okay? But the one reason I don't always let parents hold their child when I'm giving the immunization is because if baby jerks, they jerk, and they may not have good control. This way, if I'm holding the child where I need them and I have good control, one, I'm not putting mom and dad through that, and I have better control of the child. All right, so we're going to say the child is up on the exam table accordingly. I'm going to locate my injection site, which is the vastus lateralis, either the right or the left. I'm going to clean carefully. And remember all your techniques for an IM injection. Okay? And you don't have to jab, just like when we were giving injections on our newborns in labor and delivery. We don't take, the dart method, okay? Just find your site, push in, stabilize your syringe, and give. Okay? And pull out. And close your needle. Use your safety latch for that. All right. Of course, baby may be probably crying or holding their breath, okay? I usually just lay an alcohol over that, and then grab a Band-Aid and put a Band-Aid over the site just for a little while and tell mom they can take that off. I know, it's okay. It's all right, you're going to be good, okay? Mama's got you. In a minute, if you lay them across the table, be sure that you pick them up quickly as soon as you get that injection and discard that needle or make it safer, and hand them back to their mom or dad so they can console, because they're going to be able to console them a whole lot easier and faster than you and I could. All right, any questions, Mom?
I don't believe so. I think we covered everything.
Okay, well, I'll have the ladies outside make the next appointment.
Okay.
You have your information sheet, or I do. Here it is. I'll make sure you have that.
Thank you.
And you just give us a call if you have any questions or concerns.
Okay.
Okay? All right. Afterwards, class, you will be required to complete the information on the bottom of the consent with your initials, date and time, the manufacturer, the lot number and expiration, and then you will also take a medication record and document accordingly as far as which vaccine you gave, and fill in all the blanks and sign it. So that's part of the scenario. And that ends this one. Thank you.
I don't think so.
Okay. Did I do something?